First, I'd like to welcome all of our attendees to the Windshire Group's Ask the Expert series, How to Leverage the Digital Revolution in Early Stage Companies, with our special guest from the Court Square Group. My name is Jen Bardsley, and I'll be serving as your moderator for today's webinar. I currently serve as the account manager slash operations manager for the Windshire Group. So I would like to note that the views expressed in this webinar are those of the panelists. It's for informational purposes only. It's not intended as legal or regulatory advice. And to introduce our panelists, we have Dr. James Blackwell, who's president and principal consultant for the Windshire Group, which was founded in 2011. The Windshire Group accelerates development and manufacturing for commercializing therapies and provides quality expertise. Dr. Blackwell has been a leading industry consultant for more than 15 years. And we also have Keith Parent, who is a founder and CEO of Court Square Group. He leads the company and the vision for using IT as a strategic enabler for life science companies from preclinical all the way to manufacturing.
The webinar today really is the marriage of the user requirements for small companies and the marriage of that and the IT structure and organization of the company. It's a very important factor. And why is this important? This is very important for small companies because it's important for them to improve their operational efficiency. People spend less time looking for stuff, and it speeds up your business processes. And you want to facilitate decision making. You want to be able to access the most current and correct information, and it increases organizational value. A disorganized information with their information all over the place can kill a deal. We've seen that happen. Due diligence and data rooms need to be well designed and populated with good information to facilitate deal making. So that can be very important to small companies. And you're creating very valuable information. And this will be important later for your regulatory filings and for compliance needs, and for your technical people who want to access and understand the history in terms of what's happening within the organization. So this helps you avoid compliance issues later, patient privacy laws, health authority issues, or potentially even SEC violations. And also it creates a more satisfied workforce. Studies have shown people are happier when they're dealing with environments that are well organized and they're able to work efficiently. Nobody wants to be in a cumbersome, inefficient, time-wasting environment.
Question number 6. What is the impact of our technology systems on our quality system now and as we expand to clinical and submissions?
Well, again, I think it's important for small companies to start simple, keep it simple. They don't need a complex QMS system. There are ones out there that can be that are more amenable, I think, to smaller organizations, but you really have to be careful in terms of when and what systems you select there, because it's very difficult once you select one to move to another one. It can be done, but it's just another hurdle or something you have to deal with that you might be able to avoid. Certainly using SharePoint is very common in terms of document management, basic SOPs. We're working with a company now to set up that taxonomy and structure, being able to use the governance around that so that you can do things in a compliant and Alcoa, what we call Alcoa Plus type of method. You want to start with the basics with those types of systems, change control that Keith mentioned, auditing your supplier approvals, deviations, and some simple documentation management and authoring type of SOPs. And as soon as you start generating any kind of GMP, you want a simple training document or SOP around reading and approving, and these systems will advance as you mature. Certainly, as you get to phase 3 and start preparing for PII, that's when you need a very formal quality management system that'll handle all the responsibilities that you'll have as a commercial organization. So you can see as you develop as an organization, it's a ramp. And so as you mature, having that plan in place can really avoid the problems that you've heard Keith and I speak to today.
And I think, James, to that point, I think just just understanding that quality is something that you can't take for granted, and that when you put a QMS system in, it may be as simple as the process around quality and making sure you started with that, and understand that you can phase it in. It can be phased in from a paper-based approach. You can have a QMS on paper if you want. The reality is at some point you want to be able to search for that data, use that data, do stuff with that data. By phasing it in the right way as you grow as a company, you can actually incorporate that quality into all your systems across the board. And particularly, I think early on, one of the first things that James talked about was you may be working with other partners. You may be, if you're lucky enough that you get to a great solution and you found that you've got something out there that somebody else wants to work with you on, you may find a big partner out there that comes down and says, hey, we want to fund something, or we want to help you with this. But then they start looking at your systems and you can't find your data, or you can't do something. They're going to take a second look at some of that. They're going to say, well, is it really real? Our goal is to help you from day one to figure out how do we think about that. So putting some of these thoughts in place and just doing some of these simple methods of getting yourself to that point will help you in the long run from a consistency and just a viability perspective.
Absolutely. Thanks, Keith.